What do you do when you get hit by a car, right? Hopefully, you go see a trauma specialist. You go to the ER or the doctor, right? The people who you're confident know what they're doing when it comes to trauma-related injuries. What do you not do? You don't look for the influencers to teach you how to sew things up. You don't go search YouTube on how to put a bone back in place. You kind of know your limitations where you should go. But where I think we all start to get things wrong and things get a little fuzzy for most is that we're bringing movement problems, posture problems, imbalance problems to trauma specialists, and we're expecting them to fix it. And they do through the mechanism that they know how to, which is through knives, through cutting, through surgery, through joint replacement, and any other thing that you'd probably expect. Pills are probably one of the ways that happens. In fact, most often. Posture therapy, even though it can help with trauma, you're not going to do it when you have a severe wound, right? You're going to do it when you're in pain. When you've got movement-related issues, it's a means to fixing the problem on the root level. What created the chronic pain? What created the chronic movement issue? Learning where and when to bring your body to what specialist is kind of what this is all about. And in a time where there is a specialist for everything, I even saw an ad for a kneecap specialist the other day. A guy who has devoted his life to understanding the kneecap. That's great, but again, if it's a problem with the way you move and we keep bringing our problem to the specialists in a specific thing, we're not going to get the answers and we're not going to get what we're looking for. So what do? Right? What do you do when you have pain and you don't know where to go? Well, you can start by looking at what your entire body's doing. When was the last time you checked how you move? When was the last time you looked at if the left side's doing the same thing as the right side? In fact, were you ever taught how to move? I sure as hell wasn't. I was taught how to throw a dodgeball at kids in elementary school. I was taught how to kind of skip gym class in middle school. Like that's my experience with fitness at a young age. But ask yourself honestly, like when was the last time you really truly invested in learning how to move? And it sounds weird because we're all born with it, right? If you look at kids, every kid, my son's 6.5, his squat, men would kill to have, and women who love squatting, right? We want to move like kids, but why don't we? Because we overthink it. We overthink it. We take our bodies to not movement people. We tell them we're not moving well, and we expect it to get fixed with little single exercises and surgery. And it's really frustrating and challenging, especially when that stuff doesn't work. What do we then do? We actually keep doing the same thing over and over, expecting a different result. Zoom out, look at the whole body. Don't do your pillow squeezes if you get hit by a car. See the trauma expert when you actually have trauma that needs to be dealt with. The rest is up to you exploring what your body's doing. And there is no clear path. There's no teacher's guide that comes with your body. There's no cheat sheet that lays in the back. A lot of what you need to learn is a little bit of a skill. And what takes that skill to actually happen is you being a little courageous, you being a little bit explorative, and trying to discover what you need and what works for you. And only when you can do that is when you stop bringing your body to the wrong experts, because you're the expert that you're looking for. You just don't know it yet.